All right, so this next bandage I'm gonna do, we're gonna do a hand, the figure 8 method of bandaging the hand. And you would use this kind of bandage in, I guess it's more sort of like a compression bandage. If someone like sprained their ankle or wrist, or their foot or something, or again, the wrist here, around this area, and you just wanna have it so you have it secured so that way they can still kind of move their hand, but you don't want them to be able to move it too much. And it applies some nice, good compression there. And of course, you'd want to ice it at first before applying a compression bandage or something like that. You'd want to do the ice there, so you'd want to ice it for at least the first like 24 hours or so. But it's good to get ice on there to help restrict the blood flow and like bruising and stuff there, and it also will make them feel better, take away a little bit of pain when you ice it. So we're gonna start. First, you gotta secure, if this were a compression band, you'd wanna wrap it around and get it secure at first. And then you just do a figure 8 motion, so you go around the hand, or around the thumb, back of the hand, and then back to the palm. And you just kind of repeat this as you work your way up the wrist here. We're just gonna get it nice and tight, so that way we get a couple things. And then you just slowly do stair step, work your way up, and make sure it's not too tight to where you're cutting off circulation. That's why you always kind of leave fingertips, the extremities of like, so like your fingertips or your toes would be exposed. So that way you can see if they're like turning purple or something. And then you would just do another last wrap, and then we would secure it with like tape or something right there, which I don't really have any tape. And but you would normally secure that, so that way it's tight. But then again, you don't want it too tight, but it'd be tight enough to where like if they were to move their hand, they wouldn't be able to move it too much. It would just kind of keep it in a good position. So that way it secures the wrist area in here where like a sprain might occur. And you could even use this for like a muscle strain as well. So that way they kind of limits their mobility, but it's also enough to for their circulation to continue.